Okay, for the IV rate, there can be two different ways for us to indicate rate. The first one is mils per hour, and that's typically used for pump. So when you put the number in the pump, it'll be mils per hour. Another way we can indicate the IV rate is mils per minute. So there are two different ways, but they're essentially the same thing. It's just a way for us to indicate the IV rate. Okay. So Johns is critically ill and needs to be given 1,000 mils of Hartmann solution over 2 hours via the volumetric pump. What is the rate that you would set the pump at in mils per hour? So, like I said, the pump mils per hour. So that's quite simple. So we know volume to be infused 1,000 mils per 2 hours, and that gives us 500 mils per hour. And that's the number that goes you put on to the machine. A little bit more tricky question. On antibiotic A, 20 milligram comes pre-packed in 100 mils. The manufacturer recommends the drug to be given undiluted and at a rate of 10 mils per minute. Your patient has been prescribed 20 milligrams 6 hourly. Over how many minutes will this infusion need to run? So that's a little bit tricky. So it comes in 20 milligram, comes in pre-packed 100 ml, and we need to administer 20 milligrams, so we can just use this pre-packaged. So this bag contains 20 milligram, and that is a pre-packaged in 100 mils. And because we want to administer 20 milligram, we can just use that one pre-packed 100 ml bag. And that's the rate, 10 mils per minute. Do we need this for this calculation? Nope, because we already know that we can administer this as a single dose, because this need to be administered every 6 hourly. So that's kind of trying to trick you here. So we don't want this. So we got the rate, we got the volume, and what we want to know is how many minutes would this infusion need to run. So what we don't know is the time. So we come back here. So remember we said there are two different ways to indicate the infusion rate. So the second one is mils per minute. We use this formula because this is the units they use here is mils, and what we want, the time that we want to know is in minutes. So it's easier for us to use this this formula, because if you use this one, then we somehow need to convert that minutes to an hour and etc. So we know the rate. We already said, so we already know the rate. What we don't want is time. We know the volume to be infused. We know the rate. We don't know the time, and we know the volume. So the volume to be infused is 100 mils. The time, how long it's gonna run for, we don't know. The rate, yes, we know. The manufacturer recommended that the rate to be 10 mils per minute, so we know the rate. So that's the formula when we put into it. And the same thing, so we want to bring that x somehow here, so we know what x is, the time. And the way we do it is we can do times x over 10, and we need to do the same thing, x over 10, so it remains equal. And what happens is 10 cancels out and x remains, and x cancels out and that remains. We just do we just multiply that on each side so it can be equal, and we have the x remained alone, so we know how long the medication is gonna last. So that is the same as 10. Cancel it out, so 10. So we know that that medication will run over 10 minutes. So this is a little bit tricky, but it's you need to be able to do this. And